All right, everyone. My name is Erica Williams, and today I will be discussing the West Nile virus. Okay, this virus is prevalent in Africa, parts of Europe, West Asia, the Middle East, and Australia. It prefers mild winters and droughts, as this type of climate has been associated with outbreaks. The family it's part of is the Flaviviridae family. Its hosts are birds and humans, and its vectors are mosquitoes. This virus is known to cause West Nile fever, flaccid paralysis, and neurological disease, and sometimes death. It's not guaranteed, so sometimes death. All right, so the structure of this virus, it's spherical, has an envelope capsid with proteins that aid in attachment. Specifically, the glycoprotein E is responsible for receptor binding, and it has an RNA encoded capsid. As you can see in this picture, you can see the envelope protein, the lipid bilayer, and that reddish purple reddy color, the nucleocapsid, the RNA genome, and the viral tegument, which kind of looks like little bubbles almost. For pathogenesis, this virus can be separated into about 3 phases. There's the early phase, which starts with a mosquito bite, where the virus will replicate in the site of inoculation or the mosquito bite. It replicates in the Langerhans cell, right? And then it spreads, the Langerhans cells then spread to the lymph nodes and the bloodstream. Visceral organ dissemination phase is around day 3 to 4 of the infection. This is phase 2, where it will migrate to the spleen, sometimes kidney and liver, pretty much where blood would accumulate or be filtered. Then it crosses the blood-brain barrier. Around day 5, it's taken into the CNS phase, which is phase 3. This is when it's taken into the nerve cells via endocytosis. It specifically infects neurons in the gray matter of the brain, brainstem, and spinal cord, which is why this could lead to a neurological disease. As far as virulence factors are concerned, according to WHO, some of the studies have suggested that the envelope glycosylation contributes to the enhanced virulence of the North American strains of this virus. Here you can see the picture representation of the pathogenesis, starting with the mosquito, going into the early phase, replicating in the Langerhans cell, then moving through, migrating to the lymph nodes, going into the visceral organ dissemination phase, migrating to the spleen, crossing the blood-brain barrier, and then infecting the neurons in the CNS phase, or the central nervous system phase. For transmission, it starts either with an infected mosquito or an infected bird, but either way, its vector is mosquito, so the mosquito would then transfer the virus to the host, which are either the birds or the people, animals, humans, animals, via the salivary glands of the mosquitoes. Now, for animal-to-animal transmission, animals or humans would have to come in contact with infected blood or tissues. And for human-to-human transmission, humans will have to come in contact or be absorbed by organ transplant, transfusions, and breast milk of the infected type. For symptoms are pretty vague. There aren't really any defining symptoms, and according to the CDC, about 8 out of 10 infected individuals do not develop any symptoms. Those who develop symptoms may experience high fever, headache, disorientation, swollen lymph nodes, nausea, vomiting, muscle weakness or pain, joint weakness or pain, vision loss, numbness, paralysis, and even coma. Now, the last few, vision loss, numbness, paralysis, coma, headache, disorientation, that often comes when it turns into the West Nile fever or one of the two illnesses that come about of this virus, which are encephalitis, which is inflammation of the brain, and a meningitis, which is inflammation of the membrane surrounding the brain and the spinal cord. So it causes this basically because the West Nile virus, as it progresses, it can lead to lesions and neurological damage in different parts of the brain, like the hippocampus, brainstem, cerebellum. So this is why it causes, paralysis, neurological disease, inflammation. For a diagnosis, this can be diagnosed by ELISA, IgG or IgM, viral isolation by cell culture, specifically in spinal fluid, and viral detection by RT-PCR assay. Now, for these pictures down below, the one with the letter C labeled, these red portions, red-looking, ovular-looking cells, those are the presence of the West Nile virus antigens. And for the picture with the letter D on it, these sort of black, spherical, circular dots are presence of the West Nile virus cell in the endoplasmic reticulum of a nerve cell. For treatment, sadly, there's no vaccine for humans. So typically you would just treat the symptoms as they come. So if you're feeling like nauseous, or if you have a headache, you might take cold or flu symptoms to alleviate symptoms. And if you're hospitalized, you would be treated with IV fluids, respiratory support if needed, prevention of secondary infections, anti-seizure medication as it progresses to neurological disease, and corticosteroids as it progresses to a neurological disease. Because if you think back, encephalitis and meningitis are both pretty much inflammation, and corticosteroids help to reduce that. So since there isn't a vaccine, they would focus mostly on prevention to reduce transmission. So there are pretty much 3 ways to reduce the transmission: via mosquito transmission, human to animal, or human to human. For mosquito, you pretty much do the things you would do to get rid of bugs, or protect yourself from bugs. So mosquito nets are obvious, insect repellent, get rid of those bugs around you, prevent the biting of a mosquito. Human to animal, wearing gloves when handling potentially infected fluids or tissues to protect you, because if you have a cut in your hand and it comes in contact with these infected fluids or tissues, they can again get in that cut and replicate and do what they do. For human to human, obviously testing for transfusions, testing blood for transfusions, and testing organs for transplants to make sure you're not doing more harm than good and implanting an infected organ or infected blood in a patient. And that is all. Thank you so much.